Are you or aren't you? Finding out whether or not you're pregnant can be an overwhelming prospect. Just ask mom-to-be Elizabeth Boldo.
I remember there was just so many different options for me, and I was like, I don't know, which one do I pick? I spent a long time looking, reading them, and saying, well, what's the difference? You know, because you're looking at them and you're like, well, what's the difference between this one and that one? And you're looking at everything, and their prices are usually around the same. Some boxes have 2 tests in a box, 3, 1. So, you kind of, there's so many different options.
Are all pregnancy tests created equal? Not really, says OBGYN Dr. Suzanne Lajoie.
I think that there are a couple of pregnancy tests that do have some more accurate results or may get you a sooner result. The first response early result is a pregnancy test that they have done some studies, and it seems like it does have a greater sensitivity than some of the other pregnancy tests out there. The clear, blue, easy, earliest result is also a highly sensitive home pregnancy test. So maybe one of those two would be a good one to start out with.
Be sure to read the instructions carefully. Some pregnancy tests allow you to pee in a cup and then hold the stick downward in the cup like this, rather than having to urinate on that small end. Elizabeth says this may give you some more control over the process. So how soon can you take it?
Every woman, the ovulation, time of ovulation and fertilization and implantation and all these things are different. Every woman doesn't have exactly a 28-day cycle. The closer a woman gets to her date of expected menses, or the day, that she misses her period, the accuracy goes up, meaning that there are more positive tests the closer you get to your period and the day of the missed period.
That's why Dr. Lajoie says it's best to take a pregnancy test during the first few days of your missed period. Time of day also plays a role in the results.
These tests pick up HCG, so it's dependent on how much HCG is in the urine and how concentrated the urine is. So a good time of day to do it is first thing in the morning, where the urine tends to be a bit more concentrated.
The first test Elizabeth took said she wasn't pregnant.
We took it Friday night and it came back negative. And I was just like, really? And I'm still waiting. And this was a weekend where I was having a bunch of college friends, their husbands, boyfriends, some of their children, and everyone was opening up wine, drinking, and I remember being a little hesitant because I was like, I think I'm still pregnant, like I had the feeling.
You can have a negative result, and that can happen if there just isn't enough HCG in the urine. There could be a possibility that you're pregnant if you ovulated a little bit later than you calculated. So if that happens and you have a negative pregnancy test at home, you should usually follow that up about a week later and repeat it, especially if you haven't gotten your period, to see if you are in fact pregnant.
Elizabeth waited just a couple of days before giving it another shot.
So I kind of waited the weekend, and then on Sunday, I still didn't get my period. We took another test on Sunday, and I was pregnant. Even though we were we were trying, so we knew I wasn't on any form of birth control at the time, there's still a surprise, like, oh, it actually worked, it happened, We were both very excited.
Less common than the false negative is the false positive.
If you've had a recent pregnancy, it's possible that you could still have detectable levels of HCG in your urine. And so that could give you a false positive. There are also some medications that are used for fertility treatments that can give you a positive HCG result.
Any other medications shouldn't affect your results. If the test says you're pregnant, it's time to call your doctor.
When a woman comes in here and says that she had a positive home pregnancy test, first of all, there's never just one. Usually they do like 5 or 6 or 8. I don't know why. We do a urine pregnancy test here. And if that's positive, we don't know if it's a good pregnancy or sometimes you can have risk factors for an ectopic pregnancy. And if there are risk factors for that, then sometimes we can do some follow-up studies. There are prenatal labs that need to be done and prenatal vitamins that need to be started. So we usually do all that once the pregnancy test is positive.
And at about 6 weeks, you get your first look at your baby-to-be.
The doctor actually did a sonogram then, and it saw the baby. I mean, it was tiny, tiny. Like, I couldn't see it, but the doctor saw it, and he saw all the changes in the uterus, and that's when he was like, yep, you're pregnant. And he said, at that point, he estimated around 6 weeks, that I was 6 to 8 weeks pregnant.